Good afternoon, everyone. My name is Cindy again, and I'm an advanced practice nurse working in NUH, particularly rotating between the surgical intensive care unit and the high dependency. So as the topic speaks today, I'm going to share with you how we actually developed the advanced practice nurse in Singapore. In comparison to the US, they actually call the nurse practitioners. So the outline of my presentation will actually share with you the definition of the APN in Singapore, how we actually started developing this career path, and also how do we actually prepare the nurses and the full certification of becoming an APN. We will also make some comparisons between the local and the international scope of practice. And lastly, moving forward, I will share with you what some of the APNs have done recently in Singapore. Okay, so the definition of APN in Singapore is basically an umbrella term. It's a protected title given to a registered nurse who has acquired the expert knowledge base, complex decision-making skills, and clinical competencies for extended practice. They are trained in the diagnosis and management of common medical conditions, including chronic illnesses. And a master's degree is recommended for entry level. So what happens is the APN has a broad-based services, and we actually work collaboratively with the doctors to provide complex nursing care to patients in various patient populations. Okay, so a brief history or background of how we actually developed the APNs. So in 2003, we had our very first master's cohort at NUS, which is one of our local universities. And in 2005, we actually developed the criteria of how to be a fully certified APN. And in the Nurses and Midwife Acts, we actually made some amendments because the APN is actually a protected title, so anybody using the title without any authorization is considered as an offense by the Singapore Nursing Board. Okay, so 4 years down the road, the first batch of APNs were certified, and they have actually worked in various hospitals providing the services. And in 2008, that's where I actually studied. We had our very first critical care program being launched at NUS. Okay, subsequently, we had yearly intake of the master students, and in 2012, we decided that we should have a pediatric population, and so we actually crafted out the pediatric program. And in 2014, we actually reviewed and we revised the new APN certification process. So what drives the change, as in why do we need APNs? As you all know, our population is growing and it's becoming more aging with multiple complex healthcare needs. And there was a need to actually manage common chronic stable conditions. And as you know, we are actually moving towards the community. We want our patients to actually be able to know how to survive and go back to their own homes rather than staying in the hospitals. So we actually enable early discharge of this group of patients back to the community and also offer them the right siting of care. And there was also a need to start to establish a good career pathway for our nurses, to recognize this group of nurses who have strong clinical interests, and as well as to give them a good role expansion. Okay, so I'll share with you some of the stats in Singapore. So currently, to date, we have a total of 198 APNs in Singapore, with another 29 on provisional license. So they are going to take their exams this year. In time to come, with the new MOH Healthcare Work Plan 2020, we aim to project a total of 330 APNs by 2020. Okay? And in Singapore, we have 4 specialized branches or 4 career tracks. The acute care. So the acute care is where the APNs can work in both the emergency department and in the intensive care units. Medical surgical is the largest APNs population to date, where we have many specialized branches, including the oncology, gerontology, palliative care, so on and so forth. In fact, the pediatric APNs fall under the med-surg track. Okay. For community, what happens is this group of APNs, we actually see the patients at the polyclinics. Okay, and for mental health, as it speaks, we see both inpatient and outpatient psychiatric settings. So how do we prepare our nurses for the APN role? First of all, we need to attend, or rather go into the master's program, which is offered by NUS. So currently NUS, our local university, is the only university to offer the MM program. It's actually a 24 months, 2 years full-time program at NUS. And in order for you to enter that program, you need to possess a bachelor's degree in nursing from an accredited program. And you have to have at least a CAP score of 3.2 and a minimum TOEFL score for especially applicants whose native language is not English. Okay? So on top of this, what happens is after you have completed your MM program, of course you need to apply with SMB to get yourself certified on the registry. So for you to do that, in addition to getting a Master's of Nursing degree, you also need to be a full-time registered nurse with the Singapore Nursing Board. And on top of that, you have to have at least 2 years of post-advanced DIP in your relevant experience, or at least 5 years post-registration experience, of which 3 years of relevant clinical experience. So let's say, for example, I'm an ICU nurse, okay, and I want to take the Master of Nursing program. So because Master of Nursing program is a very general program, but with the specialized branches, right, you need to enter a certain branch. So I'm an ICU nurse, I will have to go into the acute care track. So let's say if I have been working since 2001, okay, until 2007, so that's a total of 6 years in my ICU specialty. Okay, this is a very busy slide, but in short, it's actually to help to prepare the APN once they exit from the MM program. So once they exit from the MM program, they are called the APN intern. So they need to fulfill at least a minimum of 1 year internship in their respective hospital and in their respective specialty. So what they do is they actually craft out an internship agreement with their clinical supervisor to design their roles and also to prepare them for the years coming ahead. In short, SMB require us to actually fulfill 1,280 clinical hours. On top of that, you have to also fulfill both formative and summative assessments. So formative assessments, what I meant was you need to have a certain number of mini CEX, chart-stimulated recalls, journal club teachings, as well as clinical logs. So after you have actually completed all the requirements, then you actually put forth your portfolio, and with recommendations from the hospital, then you can actually proceed for the full APN certification exam, which is the OSCE. Okay, so this is just a brief summary of the scope of practice between the local APN and the international version. So as we know, the international nurse practitioner, they can actually perform several roles. Okay, and these are some of the various scope of practice that we have been doing in Singapore. If you see, the level of autonomy and independence practice varies according to your institution. So what happens is after you are fully certified, what happens is you have to draft a collaborative practice agreement. So in this document, where you actually discuss with your collaborating physician in your area of practice, you design where your scope of practice will be. Okay, and then you can discuss with your physician like where and what are the kinds of job roles and responsibilities that you want to do. So of course, we are also restricted by some regulatory mechanisms. So some of the things that we can't do right now in Singapore would be, especially for number 3, where you actually can't take consent, we can't certify death, and we can't issue medical certificate. Okay, so for issuance of medical certificate, I understand from some hospitals they actually do allow, but it's according to your institution base and how comfortable a hospital is with the APN. We do have the right to diagnose. However, we do not have the authority to have prescribing rights yet. MOH is currently working on it. Currently, the APNs, we can do medication prescription, but on an outpatient setting. Okay, so what happens is the APN who sees the patient will send the draft to their consultant, who will actually look through the medication draft and they will approve accordingly. Okay, and last but not least, I think we are not able to authorize admissions of patients to the hospital. Okay? Whereas for the international APNs, they can do all. Again, it's according to their state regulatories. So in comparison to the US, because the US is purely nurse practitioner roles where they actually spend most of their time in the clinical area. However, in Singapore, we are actually a dual role. We play dual roles, so the hybrid roles. So not only do we perform direct care, we also have various other responsibilities like the education, consultancy, research, evidence-based, and leadership in professional development. Okay, so APNs in education and simulations, we do contribute back to our, not only to the hospital, but at the national level, some of the APNs, we actually do OSCE writing. So we do write up for case studies. We sometimes do standard settings for our APN exams, and we are also been invited as examiners for our APN certification. Institutional level-wise, we also conduct workshops, in-house services, and like say, for example, nursing grant round and critical care round. Beyond the institution, we also do teach and facilitate at various nursing schools, and sometimes we also collaborate with our physicians. And we get involved in workshops such as the OSPE and the LPE, which is longitudinal patient experience, where we actually bring in and share with both the medical and the nursing students on enhancing their working relationship with patients in the future. Okay, so what are the benefits of having an APN? So what I can think of is retention of good clinical nurses, because many a times, traditionally, nurses have progressed in their careers by moving up to either administrative, managerial, or educational tracks. Hence, we tend to move our nurses away from their interest, and we tend to lose these good nurses in our clinical areas. So I guess we can actually sort of enhance and increase their staff satisfaction, especially in the career development. And we also do not lose this clinical expertise in our areas. The other thing that I can think of would be higher level of critical thinking of overall nursing population. As the APNs continue to be clinical based at higher level of functioning, they can offer constant reinforcement to bedside nurses, not only teaching them, but also to enhance their knowledge and their critical thinking as well as decision-making skills. We also do provide optimal direct patient care, not only being consistent with our care, because we have always been in constant touch and exposure to clinical, so we are quite well versed with policies and standards of practice. So sometimes the doctors, especially the medical officers, they tend to do rotations, so they may not be very familiar with the environment. Comprehensiveness of the patient care, that's where we actually provide holistic approach. So we not only look at the physical aspects, we also look at the psychosocial aspects as well. And definitely with all this, we do provide quality patient care. In terms of service support, once the APN service is established, we can actually reallocate the doctor's time, because doctors are actually busy people as well, so they can't afford to see patients, every single patient. So sometimes if we can offload the doctor's free time, they can take their time to see more complex patients with higher cognitive demands. And the other thing is, we can also free up the doctor's time where they can actually do research and then in terms of enhancing patients' progress as well as their outcomes. And then lastly, of course, US studies have actually shown that we actually decrease average length of stay in a hospital so as to increase optimal utilization of the hospital beds. So what's in for us? So as you know, the MOH has recently shared their initiatives and towards 3 key shifts: better health, better care, and better life. So as you have seen recent news, now they are moving beyond healthcare to health, okay, and they are also moving beyond hospital to community, and beyond quality to value. So this is my last slide. So this is something that what we have done in Singapore. So beyond healthcare to health, we have led a few clinics, like the heart failure clinic, diabetic, stroke, hip care, and mental health. And now the government is actually advocating for people to work in the community. So we have also done things like advanced care planning and also home palliative care services, where patients would prefer to die at home. Okay, and we also created certain programs like the community and heart failure programs. And then last but not least, we have set up 2 programs, one of which is the ICU outreach program where we actually have APNs and also nurses going up to see patients who have been recently discharged from the ICU, just to make sure that they are able to transit well from ICU to the general ward and to prevent further readmissions to the ICUs. And then lastly, the MET team, which apparently has already been started in CGH, but in NUH, we are actually drafting out our proposal now. So what happens is we are actually going to see this group of patients in a general ward to actually have early recognition of this group of patients to prevent further clinical deterioration. I think that's all. Thank you.